Thyroid Peroxidase Antibodies. Number 1. Introduction. The thyroid gland is a butterfly-shaped gland located in the front of the neck. It produces hormones thyroxine T4 and triiodothyronine T3 that regulate body metabolism, energy use, and many vital functions. Thyroid peroxidase, TPO, is an enzyme that plays a crucial role in thyroid hormone production. In some people, the immune system mistakenly attacks the thyroid, producing antibodies against TPO. This can interfere with hormone production and lead to thyroid disorders. The TPOAb test is a laboratory blood test that detects and measures the level of these antibodies. Number 2. Definition. Thyroid peroxidase, TPO, an enzyme in the thyroid that helps convert iodine into thyroid hormones, T3 and T4. TPO antibodies, TPOAb, autoantibodies produced by the immune system that mistakenly target and attack TPO, leading to inflammation and destruction of thyroid tissue. The TPOAb test is an immunological test used to detect these antibodies in the bloodstream. Number 3. Indications. When doctors order this test. Doctors may order a TPOAb test if you show symptoms of hypothyroidism, tiredness, weight gain, cold intolerance, dry skin, constipation, hair loss, puffy face. Show symptoms of hyperthyroidism, weight loss, heat intolerance, palpitations, irritability, sweating, bulging eyes. Have an enlarged thyroid, goiter. Have a family history of autoimmune thyroid disease. Have another autoimmune disorder, e.g. type 1 diabetes, rheumatoid arthritis, vitiligo. Are pregnant and have thyroid symptoms or a history of thyroid disease. Had abnormal thyroid function test results, TSH, T3, T4. Are being monitored after thyroid surgery, radioactive iodine therapy, or levothyroxine treatment. Number 4. For the test is primarily used to diagnose Hashimoto's thyroiditis, most common cause of hypothyroidism, support diagnosis of Graves' disease, common cause of hyperthyroidism, evaluate unexplained goiter or nodules, assess risk of thyroid dysfunction in pregnancy and postpartum, predict future thyroid disease in people with borderline thyroid function, monitor progression of thyroid-related autoimmune conditions. Number 5. Why do need of this test? You may need this test if you have signs of thyroid disease and other thyroid tests are inconclusive. Your doctor wants to confirm if your thyroid disorder is autoimmune in nature. You are at high risk, pregnant women, people with autoimmune diseases, those with family history. Detecting TPO antibodies early can help prevent complications like infertility, pregnancy loss, or severe hypothyroidism. Number 6. What happens during the test? 1. A nurse or phlebotomist will clean the skin on your arm with antiseptic. 2. A small needle is inserted into a vein, usually at the elbow crease. 3. Blood is collected into a tube. 4. The sample is labeled and sent to the laboratory. 5. Afterward, mild soreness or bruising at the site may occur, but usually disappears quickly. 7. How long for my results? Most labs provide results in 1 to 3 working days. In some specialized centers, same-day or next-day reports may be available. 8. Prepare for this test. No fasting is required. You can eat and drink normally. Continue usual medications unless your doctor specifically advises stopping them. Tell your doctor if you are taking lithium, amiodarone, interferon, or immunosuppressants. They may affect results. Inform your doctor if you are pregnant or recently delivered a baby. Number 9. Risks to the TPOE test is very safe. Risks are minimal and related only to blood collection. Mild pain or discomfort. Bruising or swelling at needle site. Rarely fainting, dizziness, or infection. 10. Normal values. Reference ranges vary between laboratories, but generally normal, negative, 35 IU/mL, borderline, low positive, 35 to 100 IU/mL, positive, high, 100 IU/mL. NAMS number 11. Interpretation of results. Negative result. No significant autoimmune activity detected. Positive elevated results suggests autoimmune thyroid disease. High TPOAb plus high TSH indicates Hashimoto's thyroiditis, hypothyroidism. High TPO plus low TSH with high T3, T4 indicates Graves' disease, hyperthyroidism. High TPOB plus normal TSH, T4, T3, risk of developing thyroid disease in the future. Number 12, factors affecting results. Medications, interferon, amiodarone, lithium. Pregnancy and postpartum period, temporary antibody rise. Other autoimmune diseases may increase antibodies even without thyroid disease. Lab techniques. Different assays have slightly different reference values. 13. Clinical significance. Hashimoto's thyroiditis. 90% of patients have high TPOAb. Graves' disease. 70 to 80% of patients may test positive. Pregnancy. Women with positive TPOAb are at higher risk of miscarriage, preterm delivery, postpartum thyroiditis. Future risk. Even in healthy individuals, positive TPOAb indicates increased lifetime risk of thyroid dysfunction. Number 14. Know more. The test is often ordered together with TSH, thyroid-stimulating hormone, free T4 and free T3, thyroglobulin antibodies, TAB, for a full autoimmune thyroid profile. TPOAb levels do not always correlate with severity of disease, but indicate the presence of autoimmunity. The test is not a screening test for the general population. It's done only when there is a suspicion. Number 15. Conclusion. The TPOAb test is an important diagnostic tool to detect autoimmune thyroid disorders. It does not measure thyroid hormone levels, but identifies the immune system's attack on the thyroid gland. Positive results suggest increased risk for thyroid disease, even if current thyroid function is normal. Early detection helps in monitoring, preventing complications, and guiding appropriate treatment. Thank you. Have a nice day.